My name is S.R. Vijaya Anand, Tamil Nadu, near Madurai, Dindigul. Case study, Seizures.
Give him a big hand, please.
सभी को नमस्कार. Very good morning to all. आवाज नहीं आ रही है. Yeah. Okay. This is the case with regard to seizures. Presentation by, on behalf of him, I'm going to present. He is running a full-time clinic, residential clinic he is running in Dindigul, successfully for the past 15 years. Patient's name, Master Tarun, alias Majid, from Tirunelveli district. Is a 2-year-old boy, male. Date of birth is 22/11/2022, male. Patient's complete history. It's a cesarean delivery. Mother took anti-D injections. Yes. Okay. Okay. No problem. Mother took anti-D injection at the 7th month of pregnancy. Do you know what is anti-D injection? Any idea? Any idea? What is the purpose? Yes, please. Okay, let me say. The purpose of anti-D injection is to prevent the development of antibodies that could attack a baby's RBCs in a future pregnancy. That is why they put anti-D injection. Okay. And the mother took folic acid and calcium tablets. Immediately after child's birth, they put some injection. I don't know the name. He has not mentioned. After mother feeding, the infant refused mother feeding and started continuously crying. Second day, mother also got fever. Third day, mother became normal. But child sugar level become low because of continuous crying and not taking mother feeding. Some jerk also started on the child. They kept the infant in incubator for 7 days, nearly a week. After 15 days, they discharged from the hospital. But problem not yet solved. Again at home also hand jerk continues. So they decided to go to another hospital. They went to KMS hospital on 20th June 2023. There they took EEG for spasm, jerk and all. This is the diagnostic tool, EEG, on 20th 6 2023. Then the findings of hospital was Neonatal Hypoglycemic Brain Injury and Infantile Spasm. They also gave some intervention treatments. On 22nd of June 2023, they discharged from that hospital too. But still problem persists. At last, one of their friend suggested to go to and see neurotherapist Shri Vijaya Anand Ji at his residential clinic. Shri Vijaya Anand Ji running a residential clinic at Dindigul near Madurai. Then they went to Dindigul clinic and started NT treatments. Okay, what is seizure? A sudden burst of abnormal electrical activity in the brain that can cause temporary changes in the behavior. Etiology. What are the causes for disease? Neonatal hypoglycemia, infantile spasm, hyperammonemia. Okay, let us discuss first what is hypoglycemia. Hypo means you all very well know, low. And glycemia is the term used for what? Blood sugar level. So when a newborn plasma glucose levels are abnormally low. It is called neonatal hypoglycemia. Neonatal hypoglycemia. What were the causes? Malnutrition in the pregnant mother, premature births, severe hemolytic disease of the newborn. What is hemolytic disease? It is a term for condition that cause red blood cells to break down faster than the body can replace them. When the blood types of mother and baby do not match. Hypothermia. What is hypothermia? It is a medical emergency that occurs when the body's core temperature drops dangerously low. That is called hypothermia. And the genetic and the metabolic disorders. Birth asphyxia, when the baby is deprived of oxygen or oxygen levels are drastically low at birth. Then liver disease are one of the major cause for hypoglycemia. Symptoms: bluish or pale skin, breathing problems, including PAS, that is apnea, rapid shallow breathing or grunting sound, no appetite, decrease in energy level, high pitched cry or wailing. Wailing means it's a moaning, it's some sort of crying, ooh, like that. Then poor feeding or vomiting, problem in regulating body heat, that is called hypothermia. Tremors, shakiness or seizures. When our baby is at high risk of neonatal hypoglycemia, when the babies are high risk of neonatal hypoglycemia, diabetic mother, premature birth, birth under stressful condition, note this point, stressful condition, baby larger for her age of gestation, birth asphyxia, hypothermia already we have discussed, complication of NH, seizure disorder, cardiac conditions including heart failure, developmental delay, note this point, most important point, developmental delays and permanent brain damage including CP, cerebral palsy. These are the common symptoms I have already discussed. Temperature control. What is temperature control? Hypothermia. It causes increased energy consumption. It may result in hypoxia and hypoglycemia. Failure to gain weight and is an independent risk factor for mortality soon after birth. Infantile spasm. Infantile spasm it's a form of epilepsy that affect babies typically under 12-month-old. They look like brief spells of tensing or jerking and often happen in a cluster of series. That ECG report, it shows like that. Infantile spasm causes premature birth, breathless, head injury during delivery, genetic problem, genetic mutation, metabolic disorder. How to identify infantile spasm? How to identify? Jerking, muscle stiffness, arms and legs fail up in clusters, the head drops, knots repeatedly, developmental delay. These are the identification marks. How to diagnose? As I told already, EEG. That stands for what? Electroencephalogram. A painless medical test that measures the electrical activity of the brain. To measure the electrical activity of the brain, they are using EEG. What is hyperammonemia? It is a metabolic disturbance characterized by an excess of ammonia in the blood. There is a term called urea cycle disorders that can cause hyperammonemia. It can lead to lethargy, irritability, seizures. Two factors cause high levels of ammonia. This is the most important point. Two factors cause high levels of ammonia. One is liver issues and another one is urea cycle disorders. That is UCD. What is urea cycle? Normally, ammonia is processed in our liver where it is transformed to another waste product called urea. The urea is then carried to our kidneys where it is eliminated in our urine. This process is called urea cycle. What happens when the urea cycle goes wrong? UCD, urea cycle, it leads to neurological problems. Then at last brain damage. This is the main point you have to note down in your mind. Common symptoms of this particular case: spasm. Frequency of spasm 26 jerks in one cluster as per the report, EEG report. And then indigestion, constipation, sleep disorder, uncontrolled neck, not rolling yet, surviving only with medicine. This is first government hospital discharge summary. In that they have noted hypoglycemia. We have marked, highlighted. And then second hospital they went, no, that discharge summary. They have diagnosis hypoglycemia, infantile spasm. Due to that, if it is not taken care, automatically it will go to developmental delay. Frequency of spasm 26 jerks in one cluster. ECG report I have already explained clearly. This is the ECG report. That report shows. Then it is our NT. Mother's history before pregnancy, during pregnancy, child history after delivery. These reports we are taking from the mother. And that the report shows that ammonia level after the treatment, 18th September he has started 73.9, and then 13th August it has decreased to 63. Neurotherapy treatment details. Morning neutral treatment and 30 medulla, 6 ADR, 6 ADR, CNNS, gas, all three sides. Oxygen treatment, 12 medulla into 3, 4 ADR into 3, MFRN. And in the afternoon, CNNS, gas, all three sides. Large folic bag, 20 medulla, 12 medulla, 8 medulla, 2 medulla, and 1 point liver into 6. And then night. Actually, he used to talk to the patient, mother, and because they will stay in their clinic for 10 days, then he used to talk. During night, they will give, the mother will give. So these are the points they have given. Weekly once, 125 DCC multimineral treatment. Total entry treatment 30 plus 14 from July to August. Clinic, he taught the entry treatment to his parents. Up to September, treatments given by patient mother at home. From October to November, clinic again, they came to clinic for 7 days. Patient mother giving treatment again, she started at home. Monthly twice, reviews is going on. These are the logic behind the entry treatment. Neutral treatment, you know very well, for increasing oxygen level in the body and strengthen in spine and brain strength. 30 medulla, 6 ADR for inflammatory things. Oxygen treatment to increase oxygen level inside the cells. 12 medulla for control fits. Guruji said that stimulates hippocampus. It is Guruji's view. 4 ADR into 3 to increase blood sugar because hypoglycemia is there. So increase blood sugar through glucagon. And then MFRN to open or clot in cranial nerve, third ventricle of the brain. And to send, this is most important, whenever you give treatment, where it has to go, you have to decide. So that is why he has given, along with the MFRN, 1 pit, 1 thyroid, 6 ADR. To send impulses to the brain, he has used that treatment. Large folic bag for digestion, absorption of B12 and niacin, folic acid and thiamine. 20 medulla, 8 medulla, 2 medulla, 1 point liver into 6. For neurotransmitters, 28 to medullas are neurotransmitters. Why? To inhibit unnecessary body movements. 20 medulla for dopamine, 8 medulla for serotonin, 2 medulla for GABA, 1 point liver into 6 to help Kupffer cells fight against foreign antigens. And then 1 gas only 6 point. Gas only stimulates the abdomen for proper secretion of HCl, intrinsic factor, so that proper digestion of protein take place. Gas eye for stimulating entering nodes of the intestine. 6 toe finger, 1 point liver to bring down ammonia levels to normal. Serotonin formula, old UDF 120 DCC multi-mineral treatment for absorption of minerals. Do's and don'ts. PAN point increases alkalosis, so do not give PAN alone for fits, convulsions, seizures. However, such patients we can give PAN when, along with heparin formula, we can use PAN. In this disease, there is imbalance of calcium, glucose, sodium, acid, and electrolytes. Therefore, water-based fruits such as watermelon, cucumber are not to be given to this child. This is before treatment. Sorry. Not working. The video is not working. Okay. This is after video, treatment video. Okay, progress report. Before treatment, constipation were there and very poor eating habits, unnecessary body movements, increased ammonia level. Whereas after treatment, stools becomes normal. Very poor eating habits become normal. Unnecessary body movement arrested, reduced for 80% within 10 days, within a week. And increased ammonia level also decreased. Sleep disorder, but after that started sleeping well, uncontrolled. Now neck control, not rolling yet, but reduced. Surviving with medicines only. After treatment, surviving without medicines. Patient feedback. We came to know about neurotherapy, so we went to Mr. Vijaya Anand Neurotherapy. Sir said that we should take treatment for 10 days. So we stayed there and took the treatment. We could feel that our child had improved a lot by that treatment. Treatment 3 times in a day. Sir taught me the treatment. Last important point. This is most important point. You have to note down. Prevention is better than cure. Important 5 foods for the improvement of fetal brain development during pregnancy itself. If you are precautionary, there won't be any problem. So you keep it in mind. First one is iron rich. Why it is important? For hemoglobin formation and for brain development of fetal. If iron level decreases, what will happen? Anemia. That leads to low birth infant. Second one is folic acid. That is most important. Why folic acid is important? For hemoglobin formation and for neural tube formation. Later on, that neural tube will convert it as a brain and then spinal cord. So folic acid is more important. If folic acid level decreases, neural tube defect will happen. Note it down. Vitamin B12. Why it is important? For fetal development and for gene development and for RBC development. Iodine. Why it is important? For the proper production of thyroid hormone, for brain development and for nerve system development. If iodine level decreases, automatically fetal hypothyroidism will come and then cretinism will come. Cretinism means what? Both brain and body development will be less. PUFA. What is PUFA? Polyunsaturated fatty acid. Why it is important? For fetal development, for umbilical cord development, for new blood vessels formation. Note it down. This is Mr. Vijaya Anand, his clinic. It's a residential clinic at Dindigul. Thank you. Thanks a lot.